Hi, I'm Dr. Keith, and I wanted to talk to you today about vertigo or dizziness because I've had a couple of patients come into my practice this week with vertigo, and I wanted to kind of share with you the bigger picture. There's different mechanisms that are involved with this, but then more importantly, what you can do to resolve this naturally. So number one, the first type of vertigo that's out there is something that's called Meniere's disease, which is usually from a viral infection in the inner ear. This usually causes swelling in there, inflammation. People get dizzy for long periods of time, and the dizziness can last for hours or days. This type of vertigo I normally do not see in my practice. The second type, which is called benign positional vertigo, which is where you get some crystals in your inner ear that when you move into certain positions, these crystals can stimulate the hair cells in the inner ear, which then gives you the sensation that you're moving. Typically with this type of vertigo, it's usually positionally related. Where people notice this the most is when they lay down to go to bed at night. And usually when they lay down, it's usually one side that will stimulate it and not the other. So if you're laying down in bed and you lay down on your right side, this may trigger the sensation of vertigo. But when you lay down your left side, you don't feel it at all. So it's only on one side, not both. And the vertigo usually lasts anywhere between 5 to 10, maybe 15 seconds at most, and then it goes away. And it's usually pretty mild. The third type of vertigo, which is the one that I see a lot in my practice, has a combination of 3 different causes. There's one that's called cervicogenic, there's lymphatic congestion, and then there is an adrenal imbalance that triggers and can cause vertigo. Now, cervicogenic, let's talk about this. Cervicogenic means basically that you have subluxations and a lot of tight muscles up here at the base of your skull that is contributing to the inner ear, and it is heavily tied neurologically to your brain and your inner ear and your sense of balance. So when you're rotating your head from side to side or moving it into different positions, this is what triggers the vertigo. It can usually last, anywhere up to 10, 15, maybe 30 seconds, and then it goes away. So the cervicogenic is due to a neurological component with the inner ear and head rotation. The other one, lymphatic congestion. Your lymphatic system is basically the sewer system of the body, and it collects all of the metabolic debris, waste, and toxins in the body that every single cell in your entire body is connected to the lymphatic system. So if your lymphatic system is slow and congested and toxic, then this can put added pressure in the inner ear, which then you combine that with movement, it can give you that sense of vertigo. The third thing is the adrenal imbalance. Your adrenals are responsible for stress. And when you have a high amount of stress that happens all at once or low amounts of stress over time, your adrenal glands can become nutritionally out of balance and then they don't function properly. How you know this is something that's called orthostatic hypertension, where you bend over to pick something up off the floor or you bend over to tie your shoe and then you stand up quickly. You get a little lag in blood pressure or blood flow to the brain. This gives you that sense of dizziness. Lasts anywhere between 5, 10, 15, no more than 30 seconds, and then it's gone. Again, very mild. Or if you're laying down and you go to get up, or if you're seated and you go to stand up, you get that little lag time in blood pressure to the brain, it senses the vertigo. Now you can have a combination of all 3 of these, the cervicogenic, the lymphatic congestion, and the adrenal imbalance that can together can cause the vertigo, which in my 2 cases that came in this week, both of them had all 3 of them going on. So let's talk about this. What triggered their bodies to stimulate or have vertigo? Well, there's one condition that causes all symptoms, all health problems, and all disease, and that is simply stress. Stress comes in 3 separate forms: mechanical stress, emotional stress, and nutritional stress. So in both of these patients' cases, they had a significant emotional stress the day that the vertigo started. So let's look at this, right? Emotionally speaking, what are your ears? Your ears are the way that we hear things. So if you're hearing something that you don't want or is stressing your system out, that is going to affect your ears emotionally or energetically. Also, too, when you have high amounts of emotional stress, then it causes your body to become more toxic, right? Your body is producing more waste as a result of that and can easily clog up the lymphatic system, which can then put pressure in the inner ears. And then the adrenal issue, which is responsible for stress, when that gets out of balance, so can you see how when you have the cervicogenic, because when you have the lymphatic congestion and the adrenal exhaustion, it tightens up these muscles, and both of my patients, their upper necks, their muscle contraction in their upper neck was so intense. So I had to loosen that up and treat them and adjust them and support other causes to help them get rid of the stress. There's a breathing technique that I do to help release that emotional stress that helps to calm their system down. And then supporting the organs that need to be supported, either the lymphatic system or the adrenals or the sympathetic nervous system, then it can bring their body back into balance. But first, you got to identify where's the cause of it. And in both of these patients, the emotional component was the cause of that. So I helped them to release that stress, support normal function by getting them adjusted, giving them specific exercises to do at home to help keep that lymphatic system moving, and then support their body nutritionally to get their body back into balance. And within 24 to 48 hours, both of them returned back to normal and their vertigo was gone. So I hope this kind of helps give you a bigger picture of what's going on with this. If you know of anybody that's suffering it, please feel free to reach out to me. I'd be more than happy to help you in any way that I can. So thanks for watching. I'm Dr. Keith, and see you next time.